Technical group.
I'd just like to, I'd just like to make an observation with Taoiseach on your comments you made in the interview in the SIP2 Journal, where you seem to have pulled back and changed your tune and your attitude here 2 weeks ago in relation to working people actually having smartphones and being able to use them and interact with social media. Many people found that those remarks very patronising and contemptuous. But having said that, I want to raise the issue of scoliosis and the amount of children that are waiting for surgery in the Children's Hospital in Crumlin. I've been contacted by many families on this issue, and also Scoliosis Ireland, who are making the point that waiting lists have continued to increase in this area over the last period of time. As you know, scoliosis is a serious condition. It causes curvature of the spine. In the more serious cases, if not treated, it affects children, leaving their backs twisted and deformed, and it can put pressure on their lungs and hearts. More than 530 children, Taoiseach, are stuck on waiting lists for orthopaedic surgery at the Crumlin Children's Hospital. 50 children who need surgery for curvature of the spine, and children are waiting up to 18 months and more for surgery at Crumlin and Tala hospitals. Patrick Kiley, consultant at Crumlin Hospital, has said the delays not only cause increased deformity and discomfort in a growing child, but delays also lead to more complex surgery and treatment, also more costly. And a comment here for one of the papers, he says it's counterproductive. The risks rise, complications are more likely. In some cases, spinal deformity grows rapidly worse, and it's not economically sensible. Research indicates a 15 to 30% increased cost associated with correcting the more severe curves. This has been an ongoing problem for years, Taoiseach, as you know. In 2009, the HSE plan was brought in to eliminate waiting lists by spring 2010. That hasn't obviously happened. And what is needed are more surgeons, extra theatre time, more specialised areas for traction. There's only 2 in the Crumlin Hospital. I don't know where the extra resources what they will cost. It's hardly going to break the HSE compared to the costs and health costs for the families and their children. So this issue has been going on too long. It's under the radar. The families have said they've tried to raise this issue with the HSE. They're not getting concrete replies back. And would you give a commitment to these families, Taoiseach, to raise the issue urgently with the Minister for Health to deal with this issue? It has to stop, and these waiting lists have to be brought down.
Thank you.
Well, first of all, you raised the issue of phones and cameras. I'm delighted that people have lots of phones and cameras. Just in fairness, and to correct the record, Deputy, you raised the issue of what you felt was Garda behaviour and monitoring of protests in relation to Irish Water, and you were suggesting that the Gardaí were somehow not behaving properly. I said to you that because, in my experience of the people involved in the protests, everything is filmed. Everything is filmed. So if there are any suggestions that you were making, I said it would be possible to verify those by yourself.
Thank you.
Because everything is uploaded onto social media and available there. I'm actually delighted that that's the case. And if I gave any other impression, I'm very happy to correct it. I also said as well, I am a keen photographer myself, which is why looking at some of the equipment that people have, it's great to see that people have that kind of equipment. But the main point was, you were speaking about An Garda Síochána, and I just suggested to you that all of that material was available on social media, and I'm glad people are filming it, because it does mean that it's very clear what's happening. In relation then to Crumlin Children's Hospital and in relation to your questions about scoliosis, first of all, as you probably know, happily, like with social protection and the previous discussion, a lot of additional money has been allocated to the health budget, both in relation to this year and, better still, in relation to next year. Well over 800 million has been allocated. Much of that will go to our hospitals in Ireland, and as you know, the government has allocated a very significant capital project as well, capital investment, to build a new children's hospital. So as somebody who I certainly know children, I know individuals who have the condition, And what you say is correct. It's a condition that requires long-term care, long-term monitoring, particularly when it's identified early in childhood. I don't have a detailed answer to you available, obviously, in the context of this particular discussion, but what I will undertake to do is to get the information and come back to you. But in the context of over an extra 800 million being spent in relation to health in terms of additional funding for this year and for next year, and in terms of the capital investment programme, I think that there should be scope to actually improve the numbers of operation and to improve in terms of the waiting times, because obviously in terms of growing children who have this condition, that's a really important factor in their treatment. So I'll raise what you have raised with the Minister for Health and get you a more detailed reply.
Thank you for your reply. I think the issue of waiting lists is a serious issue. Patients have been told they're going to be waiting over 18 months for these surgeries, for operations. A young girl who went public, it's in the papers, a young girl by the name of Shauna Franklin from New Ross, has said she has requested that, she actually begged that penny pinching health chiefs to allow her to have a life-saving operation, and she made a point that the money shouldn't be the reason why she can't have a life-transforming operation, and it should be done sooner rather than later. The ortho-consultant population ratio is at least 2 times lower in this country than the rest of the Western world. One spinal surgeon roughly for 250,000 people. In 2009, to save costs on staff and overheads, the hospital closed 25 beds and 1 operating theatre. These have to be reopened, Taoiseach. The surgeons themselves are saying, the consultants, that they need extra theatre and they need extra time and extra surgeons in their hospital to deal with the issue. Otherwise, these lists are going to grow longer and longer, and children are going to have to be waiting longer and suffering more with further curvature of their spines and conditions deteriorating. Yes, please, Minister, on behalf of these families, not me, on behalf of these families, really urgently raise this with the Minister for Health and try and get this issue dealt with. And to say that there's more money going to the health service, since 2012, the first budget of yours, 1 billion has been taken out of the health service. It has been from 14 billion down to 13.1 billion. But that's not the issue. Money has to be made to deal with this issue of the waiting lists in the Crumlin Children's Hospital for these patients.